Thanks so much, Chairman, and thanks for holding this conversation. I think it's really important. Um, Mental health parity has been on the books for years since my friend and fellow Rhode Islander then, Patrick Kennedy, got the parity bill passed in a father-son team effort with my colleague here in the Senate, Ted Kennedy. And yet here we are many years later, still seeing continued failures in parity. And it strikes me that the enforcement mechanism is spread across multiple agencies with the result that there's no clear accountability at the end of the day. And I'm wondering if the witnesses have thoughts about how best to hold folks accountable for parity violations, whether that enforcement should be located in one place. And I'll just note that if we're able to, had we been able to pass Build Back Better, and depending on what comes ahead, there were actually the prospect of civil monetary penalties for these longstanding violations. I know that underneath it, there is a staffing issue that needs to be resolved, but it seems to me that there's also a lack of pressure from the payers to get to where they should be by law. Let me ask Dr. Ratzliff first.
Well, I do agree that we need to enforce parity. As a provider, I can see the impact of not doing that. For specific policy recommendations, I think I would defer to my colleague, Dr. Keller.
Well, that's a handoff to you, Dr. Keller.
Well, thank you, Senator. Thank you, Dr. Ratzliff. We have to continue enforcement. I do think that centralizing enforcement responsibility to DOL and both giving them the adequate staff resources and also adding civil penalties would be essential. And I think the point you raised, that there has to be a point person on the regulatory side as well. And we found that, we tried to do things in Texas back in 2017, and it is too fragmented. And really, it does take, I think, the federal effort through the Department of Labor to move that forward. We would also argue, too, that amending ERISA to allow DOL to also directly go after the administrative services organizations, the TPAs, because it's not just the purchasers that should be responsible, the group health plans, but also their administrative entities, because a lot of that advice and guidance and lack of parity is coming from their actions.
Thank you. If anybody else wants to chime in, I'd invite you to do that in a response. But, I'll make this a question for the record. If anybody wishes to follow up in writing, that would be great. But with 2 minutes left, I wanted to go to another question, which is that in the mental health arena, which is obviously a very broad one, there seem to be 3 areas where focus would be particularly useful and valuable right now. One is on children's mental health, as we've seen children's mental health issues explode through COVID. The second is in the area of addiction and recovery, as the author with Senator Portman of the CARA bill that first put investment into recovery. I think there's more room for progress in the addiction and recovery space. And the third is in the area of police encounters with people who are having a mental health crisis of some kind, and how we provide support to police departments so that they can better manage those systems and have the resources that they know they can call on when they understand that that is part of the problem that they're going to address. Very often, these people, it's not the first time there was a call. The police officers are aware that there is a problem, but they just don't have the resources to address it. So any thoughts on that, I'd appreciate, and I'll go to Dr. Ratzliff and Keller first.
Thank you for this question. So I would say I think it is really important that we are thinking about all 3 of these populations of patients that are in acute need of mental health services. I guess I would go back to focusing on, I think we need both immediate support. So especially when you think of police encounters, it is important that that person who's meeting that patient out in the community is actually able to interact with them in a different way and actually bring them to treatment, not to incarceration. I think, though, what you need then is a strong service to actually continue to provide access to care. And right now, the main place that they're going to do that, actually for all three of the issues that you raised, is primary care. So I guess I will just come back to really that it's so important to invest in really building up that system to be able to deliver care, to be able to bring in a broad workforce to work together in that space, and to be able to provide adequate reimbursement for that coordination and support of treatment.
My time has run out, so if anybody else cares to answer, if you could do so in writing as a response to a question for the record, I think the chairman would appreciate me not going on. Thank you, Chairman.